Okay, let's unpack this. Picture this scenario. You're finally grabbing a quiet moment, maybe your dog's snoozing nearby, and then suddenly just these awful gagging sounds, really unsettling. What on earth is happening? Well, today on the deep dive, we're going to zero in on something that's, well, surprisingly common, but potentially really serious for our pets. Esophageal foreign bodies.
Exactly. We've been digging into some pretty detailed info on this. Basically, think of it as when your pet swallows something and it just gets stuck. Takes a wrong turn, lodges in the esophagus, that tube from the mouth down to the stomach.
Right.
And yeah, our sources really cover the whole spectrum. What it is, how vets figure it out, the treatments, and what could possibly go wrong too.
So our goal for this deep dive, really, is to arm you with a clear picture of this medical issue. We want to, point out the signs to look for, walk through the diagnosis process, the treatment options, so you feel informed, prepared, hopefully, if you ever, heaven forbid, run into this with your own pet.
Okay, so let's start with the basics. What exactly is an esophageal foreign body?
Well, fundamentally, it's just what it sounds like. Some material, ingested stuff that gets lodged, stuck in the esophagus, causes a blockage.
A blockage. And
Yeah.
that can be partial or completely blocked.
Yeah, that's right. It can be partial, where maybe liquids can still get by, or it can be a complete obstruction, nothing getting through.
But it's more than just something physically blocking the tube, isn't it? There are other things happening internally.
Oh, absolutely. That's a crucial point. The object itself is a mechanical barrier, sure, but it also really irritates the delicate lining of the esophagus that leads to inflammation.
Like swelling and redness.
Exactly. Think about rubbing something rough on sensitive skin, same idea. It gets inflamed, swollen, and if that object stays there for a while, it can get worse. We can see something called ischemic necrosis.
Ischemic necrosis.
Huh.
That sounds serious. It is. It basically means the tissue isn't getting enough blood, enough oxygen, and it starts to die off. Sort of like kinking a hose, the flow stops, and whatever's downstream suffers. This can also, unfortunately, lead to esophageal strictures later on.
Strictures. Like a narrowing.
Precisely. Like a bottleneck forming in the esophagus after the injury heals.
Wow. Okay, so definitely not just a minor thing. Which body systems are primarily impacted then?
Well, the gastrointestinal system is obviously front and center, given the esophagus' job. But the respiratory system can get involved too.
How so?
If the animal aspirates. So if they regurgitate food or fluid and accidentally breathe some of it in, that can lead to aspiration pneumonia, a really serious lung infection.
Okay, aspiration pneumonia. Got it. So who's most at risk here? Are certain pets more likely to get these?
Yeah, the data suggests dogs are definitely more prone to this than cats. A big part of it is, well, their eating habits can be a bit indiscriminate.
Chuckles. That's putting it mildly for some dogs I know.
Right. They tend to gulp things down more, and their throat anatomy plays a role. Plus, they explore the world with their mouths, picking up stuff cats might ignore.
Ugh.
Cats tend to be a bit more deliberate about what they eat.
That makes a lot of sense. Any particular breeds of dogs that seem more susceptible?
Interestingly, yes. Smaller dog breeds often show up more frequently in the stats. And terriers, too, they seem particularly prone.
Terriers. Why them, do we think?
Well, the theory is partly their smaller size, a narrower esophagus, might make it easier for things to get stuck. But also, that typical terrier tenacity and curiosity. They might grab onto things, maybe things other breeds would leave alone.
Okay. And what about age? Is it more common in puppies, older dogs?
It's most commonly seen in young to middle-aged animals. The younger ones are still exploring everything with their mouths, learning what's food and what's not.
Right.
And maybe the middle-aged ones haven't quite outgrown those habits, or they just get unlucky.
Okay, so let's say you actually saw your pet swallow something weird, or you just suspect it. What are the key signs, the historical clues that point towards it being stuck in the esophagus?
There are several really classic signs. Retching and gagging are very common, often these unproductive attempts like they're trying to bring something up but can't.
Okay.
You might also see lethargy, just not their usual energetic self. Loss of appetite's a big one. Excessive drooling, the technical term is tyolism. And regurgitation.
Regurgitation. How is that different from vomiting?
Good question. Regurgitation is more passive. The food often comes back up looking undigested, and there isn't that forceful abdominal heaving you see with vomiting. It just sort of comes back out.
Gotcha. Any other behavioral signs to watch for?
Yeah, restlessness can be a sign they're uncomfortable. Difficulty swallowing, which we call dysphagia. Maybe they hesitate to eat or drink or seem to struggle.
Uh-huh.
And sometimes pain when swallowing. That's a dinophagia. They might yelp or shy away from food. And finally, just persistent gulping, like they're constantly trying to clear their throat.
Persistent gulping. Okay, that's a good list. Now, what about when the vet examines the pet? Are there usually obvious physical signs?
Sometimes, yes, you might see that excessive drooling we mentioned, but, and this is important, sometimes the physical exam can be completely normal, especially early on.
Really? Even if something's stuck?
Yeah. Though sometimes, if the vet gently feels along the neck or the upper abdomen, they might find a spot that's tender or painful, which can give a clue about the location.
So combining the history, what the owner saw or suspects with these signs is really key then.
Absolutely crucial.
Let's talk about the why. What actually makes an object get stuck there?
It usually comes down to the object itself, its characteristics. So its size, obviously, is it too big to fit through? Its shape, does it have sharp edges or angles that can catch on the esophageal lining?
Right.
And its texture, too. Something rough might create more friction and be less likely to slide down smoothly compared to something smooth.
Makes sense. So if you suspect this, what's the diagnostic journey? What other things does a vet need to rule out first?
Right, the differential diagnoses. Before confirming a foreign body, we need to think about other possibilities that cause similar signs. Things like just simple esophagitis inflammation without a foreign object.
Okay.
Or structural problems like we mentioned before, esophageal strictures, maybe even tumors narrowing the passage. And also megaesophagus, where the esophagus itself isn't working properly.
Megaesophagus, right. What about basic lab tests? Blood work? Urine tests? Do they help?
Often they're surprisingly normal. Routine blood counts and chemistry panels might not show much. However,
But sometimes?
yeah. Depending on how long it's been going on or how severe it is, we might see signs of dehydration, maybe some electrolyte imbalances if they haven't been eating or drinking, or perhaps signs of inflammation systemically.
So the blood work might give some clues, but it sounds like imaging is where you really get the answer, especially x-rays.
Definitely. Chest x-rays, thoracic radiographs are usually the first go-to imaging tool. And luckily, a lot of the common things pets swallow, like bones or certain toys, are radiodense.
Meaning they show up clearly on the x-ray film.
Exactly. They block the x-ray so you can see them. And these objects tend to get stuck at predictable spots where the esophagus naturally narrows.
Where are those spots usually?
There are three main ones. The thoracic inlet, which is basically where the esophagus enters the chest cavity near the base of the neck. Then at the base of the heart, where the heart kind of pushes on it. And finally, down low at the esophageal hiatus, where it passes through the diaphragm into the abdomen.
Okay, thoracic inlet, base of heart, hiatus. Good to know. What else might show up on an x-ray besides the object itself?
Well, you might see the esophagus looking wider than normal, maybe with air trapped in it above the foreign body. That suggests a blockage downstream. Although a little bit of air in the esophagus isn't always abnormal on its own.
Right. Now, what if the pet swallowed something like, I don't know, a piece of cloth or maybe some plastic that doesn't show up well on a regular x-ray?
Yeah, that happens. Those are radiolucent objects. In those cases, we often need contrast studies, like a contrast esophagram.
How does that work?
We give the pet a liquid, usually barium or sometimes an iodine-based contrast that does show up brightly on x-rays. As they swallow it, it coats the inside of the esophagus, outlining its shape. So it can reveal an object that wasn't visible before, or show narrowing or other abnormalities.
And you mentioned video fluoroscopy too.
Yes, that's basically a moving x-ray. We watch the contrast move down the esophagus in real time. It's great for seeing how the esophagus is functioning, not just its structure. It can pick up more subtle issues.
Is there a special consideration if you think there might be a tear?
Absolutely. If we suspect a perforation, a tear in the esophageal wall, we avoid barium contrast. Barium leaking out into the chest cavity can cause severe inflammation. Instead, we use a special water-soluble iodinated contrast agent. It's safer if it leaks.
Okay, safety first. What are the really worrying signs on an x-ray? The red flags that signal a major problem.
Seeing free air where it shouldn't be in the mediastinum, that space between the lungs or the pleural space around the lungs, that strongly suggests a perforation.
A hole. And that usually means...
That often means surgery is needed, not just trying to pull it out with a scope. Also, seeing fluid building up in those spaces is a bad sign. And finally, changes in the lungs themselves, what look like hazy patches or infiltrates, that could mean aspiration pneumonia has already started.
So x-rays give a great picture, but sometimes you need to look directly inside. That's esophagoscopy, right?
Exactly. Esophagoscopy uses a flexible endoscope. Think of a long, thin tube with a camera and light on the end. We gently guide it down the esophagus.
And you can see everything.
Pretty much. You get a direct, magnified view of the foreign object, its position, and crucially, the condition of the esophageal lining around it. You can see inflammation, bruising, tears.
And use it after removal, too.
Yes, it's vital.
Yeah.
After we get the object out, we go back in with the scope to carefully assess the extent of any damage. Check for hidden tears or severe trauma.
Okay, so the diagnosis is made. Time for treatment. I'm guessing speed is critical here.
Absolutely. This is considered an emergency. Prompt action is key.
Right.
And endoscopy, using that same scope, but now with special little grasping tools attached, is the preferred method for removing most of these objects.
Why endoscopy first?
It's much less invasive than open surgery, faster recovery time, fewer complications generally, if it works, and the damage isn't too bad. So we try to do it as soon as possible once we know what we're dealing with.
And if the endoscopy goes smoothly, object out, minimal damage, what happens next?
In the best case scenario, if the removal is straightforward and the esophagus looks pretty good afterwards, the pet might even be able to go home the same day.
Oh, wow. That's encouraging. But what if the scope shows more significant damage, more inflammation, or maybe small tears?
Then more intensive care is needed. If there's significant trauma, we might place a temporary feeding tube, usually a gastrostomy tube or G tube.
Straight into the stomach.
Yep, through the body wall directly into the stomach. This lets us bypass the esophagus completely for feeding, giving it time to rest and heal without food passing through. They might also need IV fluids to stay hydrated.
Okay. What about activity and diet after they go home from a routine, uncomplicated removal? Back to normal.
Activity-wise, usually pretty quickly back to normal. Diet-wise, we often recommend switching to a softer food, maybe even a liquid diet, for a short period, just to be gentle on the healing esophagus.
Makes sense. And I bet there's some important advice for owners after this happens.
Oh, definitely. Client education is huge. We talk about the potential for complications down the road, even after successful removal, and unfortunately the risk of it happening again if the pet's scavenging habits don't change.
Yeah, preventing round 2 is important. So endoscopy is plan A. When does surgery become plan B or even plan A?
Surgery and esophagotomy is needed in a few situations. If we just can't get the object out with the scope after trying, or sometimes we can push the object down into the stomach. But if it's something large or sharp that won't pass safely through the intestines, it still needs to come out, often via surgery on the stomach, a gastrotomy. And of course, if there's a large perforation found or significant tissue death, surgery is required to repair the esophagus itself.
I remember reading something specific about bones. Sometimes you push them into the stomach instead of pulling them out.
Yes, that's an interesting point. With bones, especially if they're jagged or firmly wedged, trying to pull them back up can cause more tearing and damage to the esophagus.
Right.
So often the gentler approach is to try and carefully nudge it forward into the stomach. The stomach's acidic environment can actually help dissolve or break down bone over time.
Ah, okay. But that wouldn't work for, say, a plastic toy.
Exactly. Non-digestible things like plastic, wood, metal, if they get pushed into the stomach and are too big to pass, they'll likely still need surgical removal from the stomach eventually.
Got it. What about medications? What helps during recovery?
Medications are really important for supporting healing. If there's significant esophagitis inflammation, we often use sucralfate.
What does that do?
It forms a kind of protective layer, like a liquid bandage, over the irritated or ulcerated areas in the esophagus. Helps it heal, reduces pain.
Okay.
We also use acid reducers. Usually proton pump inhibitors, like omeprazole, are preferred to strongly decrease stomach acid production. Less acid refluxing up means less irritation. For milder cases, maybe an H2 blocker like famotidine.
Any other meds?
If we're worried about small tears or infection risk, broad-spectrum antibiotics might be given. And sometimes drugs to help the stomach empty faster prokinetics, like metoclopramide or cisapride, to further reduce reflux potential. And maybe, carefully, some viscous lidocaine gel for pain relief right in the esophagus.
Wow, quite the cocktail potentially. And follow-up care sounds absolutely essential after all this.
Crucial. A repeat endoscopy a few days later is often recommended.
To look again.
Yeah, to really assess how the healing is progressing. Mild redness, maybe some superficial erosions, that's pretty common and usually heals fine. But we need to check for anything worse.
And if there was a significant tear or damage initially?
Then the supportive care continues. Maybe they need IV nutrition, feeding directly into the bloodstream, or continued feeding through that G-tube until the esophagus is strong enough. We also often take follow-up x-rays to make sure no air is leaking into the chest, which would mean a perforation hasn't fully healed.
And long term, What's the main thing to watch for?
The biggest long-term concern is the development of an esophageal stricture, that narrowing we talked about.
Right.
So owners need to monitor really closely for weeks, even months afterwards. Watch for any return of regurgitation, difficulty swallowing, or pain when eating. If those signs appear, more imaging, like a contrast study, might be needed to diagnose a stricture, which then requires its own treatment, often balloon dilation.
It really highlights that the recovery isn't always straightforward, which brings us back to prevention being the best medicine.
Absolutely, just being really vigilant about what your pet has access to. Supervising treat time, choosing safe toys, managing the environment, it can make a huge difference.
But even with the best care, accidents happen. What are the potential complications we might see? You mentioned about 25% of cases.
Yeah, roughly a quarter might develop complications. We've touched on most of them. Esophageal perforation is a big one. Stricture formation.
Oh, yeah?
Less commonly, you can get abnormal connections forming, like fistulas between the esophagus and airways, called bronchoesophageal fistulas.
Wow.
Severe ongoing esophagitis can be a problem too, and sometimes temporary issues with how the esophageal muscles contract. Perforations are especially worrying because they can lead to really serious secondary problems: air or fluid in the chest, pneumonia, pleuritis, mediastinitis, nasty infections.
That sounds like a serious list. So, weighing all that, what's the general outlook? What's the prognosis?
The good news is, for the majority of pets, especially if the object is removed quickly and the initial damage is minimal, the prognosis is actually very good. Most make a full recovery without lasting issues.
That's reassuring.
However, if significant complications like perforation or severe strictures develop, then the prognosis becomes more guarded. It often means more intensive treatment, longer recovery, and potentially lifelong management issues.
Okay, so just to kind of wrap up the key takeaways, esophageal foreign bodies, they're a definite risk. Dogs maybe more so than cats. Spotting those signs, the gagging, retching, drooling, trouble swallowing, acting fast, getting veterinary help, that's all crucial.
Mm-hmm.
And understanding the diagnosis, usually involving x-rays, maybe endoscopy, and the treatment, preferably endoscopy first, is key for a good outcome.
Absolutely. And it's just, a powerful reminder for all of us pet owners to be mindful of what our curious companions might decide looks tasty or fun to chew on.
Definitely. So, thinking about how common this can be and how serious, maybe a final thought for our listeners. What everyday things in your house, or even specific treats you give your pet, might pose a hidden risk, and what concrete steps could you take, maybe even starting today, to make your home environment safer and minimize those dangers? Something important to mull over.
A very practical takeaway.
Thanks so much. This was incredibly informative, a really valuable deep dive.